Welcome, everyone. I'm glad to have you here with us for today's panel discussion. We hope to give you a lot of information about the vaccine, about the safety of the vaccine and availability of the vaccine, and why you should not hesitate. Today's panel discussion is called Don't Hesitate to Vaccinate, and our experts tell you why. I should introduce myself and tell you I'm Jade Hindman. I am co-host of Midday Edition on KPBS. But joining us today, we have a panel of experts who are all here to answer your questions and give you all the information that you need to know about the status of the pandemic and the vaccine. We have joining us Dr. Jamal Gwathney. He is a medical doctor, clinical director, Metropolitan Correctional Center and the San Diego Federal Bureau of Prisons and the National Public Health Department as well. He has been a board certified family medicine physician for over 20 years and is currently an active duty captain in the United States Public Health Service. During his career, he has served underserved communities across the country and really across the world. He has been a medical director of a community health center in Washington, D.C., deployed to help lead a unit to fight Ebola in Liberia, and supported the community of Flint, Michigan during the lead water crisis. And he's been stationed as the medical director of the Federal Bureau of Prisons facility in San Diego for the past 8 years, and that is Dr. Jamal Gwathney. And I'd like to also introduce Dr. Rodney Hood, president and chairman of the Multicultural Foundation. After 40 years in medical practice in Southeast San Diego as a board certified physician of internal medicine in CareView Medical Group, he recently merged his medical practice with San Ysidro Health Centers. He co-founded and became president of an independent physician association, the Multicultural Medical Group, consisting of over 150 primary care physicians and 200 specialists managing health plan and provider contracts. The IPA managed health services to over 25,000 enrollees, mostly from underserved communities. And in 2012, Dr. Hood spearheaded a $1.2 million CMMI Healthcare Innovation Challenge. Over the past 30 years, Dr. Hood has researched and lectured extensively on the historic aspects of race, ethnicity, genetics, and racism in medicine, and the impact on today's health inequities. And that is Dr. Hood for you. I'd like to also introduce Wilma J. Wooten. She is the Public Health Officer and Director of Public Health Services in the County of San Diego, Health and Human Services Agency. We always hear so much from Dr. Wooten, and she's really been leading us through this. She receives both professional degrees from the University of North Carolina, Chapel Hill, followed by the completion of residency training at the Georgetown Providence Hospital Family Practice Residency Program in Washington, D.C. In 1989, she completed the joint San Diego State University Graduate School of Public Health, University of California, San Diego Preventative Medicine Residency with an emphasis in sports medicine. And you know, she is a member of a number of organizations here in San Diego. Those are our guests and our panelists today here to answer all of your questions. We want to first start with a poll question for you, and hopefully that will populate in your screen there. There it is. It is, are you planning to get the COVID vaccine when it is available to you? That is the big question. And for those of you who are unsure on the answer of that, we hope by the end of tonight, you'll have the answer that you need. And so as we see the numbers coming in right now. But as you guys fill that out, we will circle back to that at the end of the program. We'll also have a section of the program where you can ask your questions of our expert panelists, and we will do our best to get the answers to you. But at this point, I want to give everyone an opportunity to speak to the audience. And Dr. Wooten has truly been on the front line leading the public health services and keeping our county safe. She'll talk to us about the importance of immunizations and why it's not too late to get the flu vaccine. Dr. Wooten?
Yes, thank you very much. Do you want me to get started?
Yes.
All right then. So if you could pull up my slide deck. And in the next slide, I just want to share with you the definitions of influenza versus the COVID-19, which is the SARS-CoV-2 virus. Now, influenza has been around. Actually, the last significant pandemic, one of the major pandemics in the U.S. was in 1919, an influenza pandemic. Currently, there are two major strains or two major types of influenza viruses, influenza A and influenza B. And the reason we get a vaccination every flu season is because these strains mutate and change, much like you're hearing about the change with the COVID-19 B117 out of the UK, as well as a South African variant and a Brazilian variant. The coronavirus that is responsible for the pandemic, the current pandemic, is a novel coronavirus. It had not been detected before it was identified in December of 2019. Now, we certainly do have other coronaviruses. There are about 7, and 4 are caused by or cause the common cold. And then, of course, we had an epidemic of a SARS epidemic in 2003 in Toronto, Canada, that also originated from China. And it is called corona because of the spikes, the crown-like spikes that occur on the surface. So going to the next slide, I'm not going to go into this next slide, but this is actually for just your reference. It basically explains the difference between coronavirus, flu, and the cold. And for coronavirus, it certainly is more contagious than influenza, or especially it's more contagious than the common cold. Now there are several treatments for this novel coronavirus, including steroids, monoclonal antibodies that are useful for those individuals that are not hospitalized, but is administered through hospitals or community clinics that have current access to the treatment from the federal government. And also plasma is a treatment that's being currently used. And then we currently, because things change every day, but today we have 2 vaccines that have received the emergency use authorization from the United States FDA. And we anticipate the first 2 are Pfizer and Moderna, and then we have a third one from Johnson & Johnson that is expected sometime in February. And there are 2 more that are pending after that. So that's where we are with vaccines for coronavirus. There is no vaccine for the common cold, but for influenza, as I stated before, every year we encourage everyone 6 months of age and older to be vaccinated against influenza. And now the influenza vaccine is what we call a quattrovirus because it has 4 components related to 4 different strains of the influenza virus. These are dead viruses, so they can't give you the flu, even though some people say that when they get vaccinated against the flu, they get the flu. Impossible with the injectable version. So let's move on to the next slide, and this actually has a comparison now focusing on just the flu and COVID-19 with, in the center there, the green, characteristics that are common between the 2. And I'll focus on that section of the slide. Both viruses are transmitted through respiratory droplets, For COVID-19, if there are procedures that produce aerosolizations, we want individuals to wear, healthcare providers to wear their N95 masks that are fitted. You just can't just pick up an N95 off the shelf. It needs to be fitted. Symptoms, there are symptoms that are very common: fever, cough, difficulty breathing, fatigue, body aches, runny nose, headache, and sore throat. But we also know that CDC reports that at least 40% of individuals or higher may not have any symptoms at all. And in San Diego, of all of our reported confirmed cases, about 16% of individuals have not had any symptoms. For COVID-19, there are some other symptoms that are also significant and lets you know, it helps you to differentiate between COVID versus the flu, and that includes a loss of taste or smell. And then complications, both have complications associated with pneumonia and including death. So the preventive strategies that we use and promote against COVID-19 also work against the influenza virus. I'm going to, the next two slides, actually, if you can go to the next slide, gives an overview of the impact of influenza, and the next slide will be COVID-19, but the impact on the general population in the U.S. For influenza, there are 12 to 61,000 deaths annually. 140 to 810,000 individuals have severe complications and hospitalizations. And then in general, the CDC reports that influenza impacts anywhere from 9.3 to 45 million individuals. And these are just individuals that have been tested. We certainly know that this is the tip of the iceberg, and many more individuals are impacted. They just may not go to the doctor for a test to verify their diagnosis. If we go to the next slide, this is a nationwide account of COVID-19 as of the 28th. And 25 million, over 25 million individuals have been impacted or have been diagnosed with COVID-19. And in the last 7 days, it's been a daily average per 100,000 of 48, almost 49 per 100,000. 49 cases per 100,000. Total deaths in the U.S. is almost reaching 450,000. If we go to the next slide, drilling this down to the San Diego community. In San Diego, if many of you follow our influenza watch that's published every week during flu season, this is a stark difference from last year this same time. So far, and this is since we look at our flu seasons from July 1 to June 30th every year, and the flu watch is published every Tuesday. This year, it's every every Wednesday. But this was our recent publication this week as of the 27th. We have had no flu deaths, no pediatric deaths, no outbreaks. The number at the top is the total number of viral detections that have been documented in San Diego, 662. And this is in comparison to over 20,000 for the flu season 2019-2020. So in the next slide, and the pie chart there, go back please. The pie chart just basically shows in the green, influenza A is about 48.5% responsible for the 662 viral detections, and 52% are represented by influenza B, with 0.5% being influenza where the type is not known. In the next slide, This information is from our COVID Watch, which is published every Tuesday in the county. And this particular issue from this week has data through the week ending January 23rd. So as of that date, we had 227,195 cases of COVID-19 with a median age of 36 and an age range of 0 to 108 cases. And obviously, for deaths, our median age is 78, and the range is from 19 to 103 years of age. And with outbreaks, we've had 1,584 outbreaks, including our SNFs, skilled nursing facilities, congregate care facilities, and our community settings. So, and this represents 29% of outbreaks in the community. I think this category is just for our congregate settings, which would be SNFs, as well as other congregate settings, which includes juvenile detentions and jails. Moving to the next slide. Some good news, if you can count it as good news, we feel it is. The number of daily cases have decreased, and in the last 5 days have been less than 1,500. So in our next slide, we want to talk about the importance of getting the flu vaccine. So because we know that COVID-19, we would see surges, particularly after the Thanksgiving and December holidays, we have been promoting and encouraging everyone 6 months of age and older to be vaccinated against influenza. The reason being, if you are vaccinated, you less chances of becoming ill and therefore having complications landing you in our hospitals. So vaccination for influenza is to help make sure that our healthcare system, our hospitalization beds and our ICU beds are not impacted. And we've seen that this has been of significant service to our San Diego community by individuals being vaccinated. In this next slide, it actually shows, it compares for the current influenza season as well as prior influenza seasons, where we are with vaccinations for influenza. And again, this is by CDC week and season. So currently the last for our flu season 2020-2021 to date, we have had 1,156,000 plus individuals vaccinated with influenza. We anticipate that we will exceed last year's total, which was 1,234,474. And you can see that for the past 5 influenza seasons, we have been increasing the vaccination numbers of our local region. Moving on to the next slide, looking at vaccinations for COVID-19. This is our dashboard that's on our county's website. You'll see at the top that as of January 27th, which was yesterday, we had 485,900 doses of vaccine, both the Pfizer and Moderna, shipped to San Diego. We are rerunning these numbers because we've been working with local providers to improve the delta between the top number and the far right number, the 269,218. That's the total number of individuals or vaccines or doses that have been administered to individuals in San Diego. 224,000 plus are individuals that have had the first dose only, and 45,187 have had the second dose only. Now, also I want to share with you in just the few minutes that I have left, in the next slide, this is a metric that we monitor. The yellow is influenza-like illnesses. as well as COVID-like illnesses that are presenting to our emergency departments. The yellow influenza is at about between 2 and 3%, which is very close to baseline. And the reason we feel this is low is, again, because of the preventive strategies that we continuously encourage people to adhere to, and you'll be hearing it at the end of this presentation. COVID-19-like illnesses is slightly elevated, and that should be logical because of our increased number of cases, particularly over the holidays and into the first 3 weeks so far, almost the first 4 weeks of January. Moving to the next slide, I just want to talk about vaccinations. San Diego has almost 3.4 million individuals, so that's a total population. The vaccines are approved for individuals 16 years of age and older, and particularly only Pfizer is approved for below 18. So it is 16 and 17 as well as beyond, and Moderna is approved for 18 years of age and older. The CDC is recommending that all local jurisdictions strive to achieve 70% vaccination of the targeted or focused population, and you see that number for San Diego is about 1.9 million. And our goal is to administer very close to what we achieve with testing, close to 25,000 vaccines daily. And that is what we've achieved. We've gotten as high as 27,000 tests in San Diego on a daily basis. That has now decreased a bit to 19,000. So in the next slide, just want to quickly go through where we are with who should be vaccinated. And we are vaccinating everyone in the phase 1A. As you see on this slide, there's this one phase 1A with 3 tiers. These are all healthcare professionals or personnel, and that is a very broad definition. If you go to the next slide, we are also vaccinating individuals 75 and older and individuals 65 to 74. So hence, everyone 65 years of age and older are currently now being vaccinated. With the next group to be vaccinated will be individuals that are in these essential worker categories, which includes child care and education, emergency services, and food and agriculture. We plan to open those groups up in February. Tier 2 of 1B is next in line, and then we will follow suit with phase 1C. And then final, phase 2 includes individuals that were not included prior. I want to just draw your attention to phase 1C. That includes individuals 50 to 64 years of age, as well as people that are 16 to 49 that have underlying medical conditions or disabilities. And then the remaining essential worker categories will be included. So on the last slide, these are the various strategies of how we administer. Just briefly, we have community setting pods that vaccinate about 500 individuals on a daily basis, and then we have our superstation pods, Petco Park, and we have 4 others that will be open, actually 3 others for a total of 4, that will be open by February 1st, and they can vaccinate up to 5,000. And if you go to the next slide, this is on the website, but it shows where our testing sites are on the right side of the slide, and then on the left side are the locations where testing sites are currently open. And finally, I end any and all of my presentations with information about the best practices. CDC calls the first three circles the three W's. Wash your hands, watch your distance, and wear your face covering. If you are sick, stay home and get tested. CDC recommends that those who have been infected should wait at least 90 days after resolution of their symptoms. And when it is your time to be vaccinated, get vaccinated. Thank you, and that concludes my presentation.
All right. Dr. Wilma Wooten, thank you very much for that information. Again, if you have questions, keep them coming in. Once everyone is finished with their presentation, we will circle back to them and get the answers for you. I want to move now to Dr. Rodney Hood, who is going to tell us about the COVID vaccine and the vaccine hesitancy that exists in the African American community and communities of color. Dr. Hood?
Good evening, everybody. We're going to talk about vaccine hesitancy, and the importance of that is that, as you heard Dr. Wooten state, is that we really want to get herd immunity. 70% or more of the individuals in San Diego County vaccinated. However, if there's hesitancy, that makes it a little bit harder to kind of reach that goal. And vaccine hesitancy, as you can see from some of the numbers I'm going to present, actually puts the risk of health disparities, actually making them worse in the people of color and minority communities. So there are three groups of vaccine hesitant individuals. And a vaccine hesitant individual is somebody who harbors beliefs, myths, lack of accurate knowledge, or distrust, resulting in a reluctance to receive the vaccination. So we've got those who lack information. That's why they don't want to get it. The strategy for that is finding a way to distribute accurate information. For those who have a lack of trust, we need to find a way to give accurate information and have a trusted messenger that population can relate to, that may take the message in a more believable way. And then we have what I call the holistic resistor. This is somebody who, for whatever reason, sometimes they believe in the natural way of things. They just don't believe in taking drugs or vaccines. Some of them have religious beliefs. And the strategy for them is both A and B, plus showing respect and stressing all the things that Dr. Wooten talked about: social distancing, wearing a mask. I believe in vitamin D, C, and zinc, although none of those have been proven to prevent COVID, but I do think they help your immune system. This is just a national survey that was done in September of this year. And this is asking the question of US adults who say they would definitely or probably get the vaccine for COVID. So you can see over a 4-month period, beginning in May of this year, ending in September of this year, where there was a decrease when we look at gender, age, race, ethnicity, and education. What was happening during this 4 months? Well, we all watch TV, and we had a previous administration that was giving inconsistent and non-scientific messages. This kind of corrupted the trusted usual messages coming out of FDA and CDC. They were talking about warp speed and the distrust as who would get it in all categories actually went down. I think what's we see a difference in hesitancy here with men and women. It's about 11% at the end of September. With age, we see the younger individuals were more hesitant than the older individuals. Under education, the less educated were more hesitated than those with a higher degree. And then by race and ethnicity, I think this is where we see the greatest gap of about 40%, where Blacks are about, where at the end of September, only 32% said they would probably get vaccinated at that time. as high as 72% in Asians. So this is a national study, but you can see this is real. I can tell you since then, these numbers have been improving, and I think they've been improving because message is getting out there. There's been a lot of education about the vaccine, and plus what's going on with the raging of vaccine and more people dying. I think is kind of people getting realistic. So people often ask, what causes this hesitancy? This was a national survey that was actually done between April and May of this year, when they asked the question, what percentage of US adults have confidence in medical scientists to act in the best interest of the public, have a mostly positive view of medical research scientists, or have a mostly positive view of medical doctors. You can see in all categories, African Americans rate the lowest. For medical scientists, only about a third of Blacks said that they had any significant trust, and between 43 and 45% white Hispanics. About a positive view of medical scientists is only about 53% African Americans and 67, 68% white Hispanic. And when we ask about doctors, a little bit higher, but Blacks are still lower. So what actually causes this significant decrease? And let me just state very quickly, this is a whole lecture in itself, and everybody hears about Tuskegee, but I think if you believe that it's just Tuskegee that causes this, we need to study our history, because this actually goes back what I call the ethno-historic legacy of slavery and Jim Crow, where during slavery, there were individuals, Sam Cartwright, who experimented on Blacks in Louisiana. He was professor of the Negro, that was his title, where he claimed that he called Blacks suffered with drapetomania. It was a mental disease, a runaway madness, and dysesthesia ethiopica, which was a rebelliousness. And that was because slaves were running away from the plantation. So they had to be crazy if they ran away from the plantation. We had Sam Morton, who taught the theory of phrenology, where he measured the skulls of Blacks and whites and said Blacks were inferior. We had J. Marion Sims, who operated on Black women to the point where they were addicted to opiates. So if you're interested, there's a book called Harriet Washington called Medical Apartheid that really goes off into the history of the inappropriate research that has been done on African Americans. So don't believe it's just about Tuskegee. There's a multi-century history of inappropriateness. So the reluctance and distrust in the scientists and medical research in the Black community is alive and well. Is a significant reason why. Now, so those were national series. Right here in San Diego, there was a recent study done by the county, I think led by Dr. Wooten, where they recently asked, what do people think about COVID and getting a vaccine? This was just done, I think it was up through early July of this year, where a total of 72% said they were likely to get the vaccine, and a total of 22% unlikely. Going back to October, that 72% was down to 53%, and that 32% went down to 22%. So as you can see, over the past several months, as people learn about the vaccine, getting more knowledge out there, the resistance seems to be getting better. This is also from that same San Diego County. So these are San Diego County residents. And the question was, would you be unlikely to take the COVID vaccine when it becomes available to you? And if not, what were some of your concerns? And you can see about 37, 40% were concerned about side effects, allergies, et cetera. We've got about 21% just don't trust it or the government. about 20% being felt it was too rushed, and about another 20% just were misinformed about they didn't need it. So these are the reasons, and I think down here is what I call my vaccine resistors or my vaccine objectors. They just don't believe in vaccines or shots. So next is, you can see by age, there's a difference. The older individuals seem to be more acceptant of the vaccine versus the young. This is the totally unlikely, but the older you are, the more acceptable you are. And that's probably a good thing because it's the older ones that are more vulnerable. If we look at it by race, this is San Diego County. We can see overall, people of color have have more hesitancy, very likely 47%, somewhat likely 64%, combined about 71% when compared to whites. But as we can see, African Americans have significantly less, and especially when we're talking about totally unlikely. Who do they trust? So if you got a distrust factor, I think it's important to know who folks trust to give them the information. And this survey points out that doctors, personal doctor, nurses, medical researchers, friends and family, scientists, CDC, all of these are highly rated as trusted messages. And I think that's important if we're going to get the word out. Who we trust, who should be given the message. And this goes across the board. Because I'm trying to keep this short. If you look at African Americans, it's very similar. But if you say Black doctors or a doctor of color, it's even higher than just doctors. So I think we have to realize that in our messaging to the community. This gives us some insights as to how we need to approach vaccine hesitancy. So I'm going to show you this. This actually started with a meme that I received from a friend. It was actually Dr. Nick in the county, simply something on vaccine hesitancy in Kaiser. And I looked at the meme, and then the next day I was talking to one of my patients, and I'm still seeing patients and talking to them over the phone. And I was refilling his medications for his blood pressure, and one of his other medications was Viagra. And when I asked him about getting the flu shot, I don't think he's had the flu shot in 5-6 years. He said, no, doc, every time I take that, I get sick. I said, well, what about this COVID shot? Doc, I don't know if I trust that shot. I said, why? I said, well, I don't know what those pharmaceutical companies do. I said, oh, you're not sure. I said, well, do you know who makes Viagra? He said, no. I said, Pfizer. I said, do you know who makes the new COVID-19 vaccine? He said, no. I said, Pfizer. I said, so maybe I shouldn't give you your Viagra because I don't want to give you something that you don't trust. He said, oh, doc, don't do that. So, of course, I gave him his medications, but I can tell you he agreed to take the COVID vaccine. So stay safe, protected, get vaccinated. And in summary, I think we need to have an equitable vaccination strategy for San Diego community. And it should include respect everybody, even if they're hesitant, even if they object. We need to show love, knowledge, and understanding. The strategy for the acceptor is overcoming the issues of capacity, overcoming the issues of access. We've got to make sure that they can access it, hopefully in the communities where they live, and make sure there's no cost that's causing them not to get it. For the vaccine hesitant group, we need to do a targeted outreach. What I mean by that, we must not be afraid to talk about race, because sometimes it's not just targeting the old and the youth. It's not just targeting by geographic area. Yes, that's important. But from the data that I showed, we've got differences by race. So we need to do a targeted outreach approach with education, scientific data, trusted messengers that make sense for that population, And especially in the African-American community, we need to engage the faith community, sororities, fraternities, and as I showed you, the healthcare professionals, which have the highest trusted level in all areas, especially African-Americans in community-based organizations. And since we only have to get above 70% or more herd immunity, we would like everybody, but we don't have to get everybody. But this objector who just says, I don't care what you say, doc, I am not taking that medication. We got to encourage safe mitigation, healthy lifestyle, physical distancing, limiting travel, avoid crowded places, washing hands, masks. As I said, I'm a believer in vitamin D and C. This was also from the county survey when they asked, where do you feel most comfortable getting your treatment and vaccination? Doctor's offices, community clinics, and pharmacy was at the top of the list. And I put that up there because right now in the early phases where the vaccine is just being rolled out, we're having these mass vaccination sites, which are definitely necessary. But as we start vaccinating the major populations, we need to find a way to make sure we're getting them into doctors' offices and clinics where patients, especially the hesitant ones, feel a little bit safer. They don't always feel comfortable going to the grocery store, community center, et cetera. And I know Dr. Wooten and the county are already planning on this and thinking of this. So in summary, vaccine hesitancy in San Diego County, the good news is that greater than 72% are likely to get vaccinated, with the highest acceptance among the older adults, which is the highest risk population. The bad news is that people of color, especially Blacks and African Americans, have the highest hesitancy, along with the young and along with the lower educated. Those convincing messages are doctors, nurses, and medical researchers, and we need to find a way to insert them into our outreach. Thank you. You're on mute.
Still on mute. There we go. Dr. Rodney Hood, thank you very much for that. Again, if you have any questions, please go ahead and submit them, and we will get to those at the end of the presentations. I want to go now to Dr. Jamal Gwathney. He's going to talk about clinical trials and the real life experiences with the COVID vaccine, as well as the public health implications of not getting that vaccine. Dr. Gwathney?
All right, well, thank you for having me, and thank you, and it's great to be here with the other panelists. I think I was asked to talk about the clinical trial because I've done a lot of research on the trials, specifically the Moderna and the Pfizer vaccines. I've done a lot of presentations. We've given many vaccines at my facility, but probably most importantly, I'm actually a study participant right now. I am currently in specifically the Moderna trial and have been since August of this year. I joined for the main reason of wanting African-American representation and volunteerism in these studies. Typically in NIH-funded studies, usually only about 5% of the participants are actually African-American, when 13.4% of the US population is Black. So we need to have more representation in clinical trials. So if, I did my research, I looked at the earlier research studies, meaning the phase 1, phase 2. I found that they were safe and then volunteered for the study myself. I'll go into my personal experience. But if you're interested in clinical trials, please talk to someone, as Dr. Hood mentioned, doctors, nurses, someone who knows about clinical trials. Could be a scientist that you know. See if it's something that you'd be interested in, because we need more representation in these studies to make sure that when new medications come out, new vaccines come out, that they're not giving them or offering to us for the first time after the studies have been done. We want to be included in the studies to make sure that they are safe and effective for us before they get approved. Next slide, please. Next slide. So this here was as Dr. Hood discussed, African Americans have been wronged by the scientific community for years. But it's not just years ago. Like I said before, like was mentioned before, I was in Flint, Michigan, where the state government blatantly lied to the people of Flint, Michigan. And I was on the ground there talking to the residents of Flint, making sure their messages were heard and their desires and wants and needs were heard and brought to the county, state, and federal levels. I think things are happening in medicine right now that are issues where females who are pregnant should not, and African American should not die 3 times as much as their white counterparts. So I think this article here that I brought up is in the New England Journal of Medicine back in October of 2020. And it really struck a chord with me: trustworthiness before trust. And the article basically just discusses how it would be insane to just bring a new medicine, bring a new vaccine, and ask the African American community to just trust us and trust that it's going to work. That would be insane. What needs to happen is that the scientific community needs to earn our trust and basically be worthy of our trust, hence the title, Trustworthiness. And so I'd like to talk a little bit more about how I think the research community has actually started showing us that they are trustworthy. Next slide. So before we get into actually this slide, I want to talk about, was this too fast? Was the process too fast? Operation Warp Speed. And was it fast? Yes, it was. Did it need to be fast? Yes, it did. We have over 400,000 COVID-19 deaths right now. The only other time that we've had this many deaths from a contagious disease was, as Dr. Wooten mentioned, the 1918 H1N1 flu. And so we needed something to be fast. And luckily, our technology has improved over 100 years, and we were able to get something out faster. I want people to know that these pharmaceutical companies did not take a big risk. Our federal government actually took the risk and paid the pharmaceutical companies billions of dollars, literally, to actually start producing the vaccine before they even knew if it was going to get approved, if it was safe, if it was effective, because they wanted to have it ready to be distributed if it was approved. So the federal government took a big risk in giving pharmaceutical companies a lot of money. And this mRNA, these Pfizer and Moderna vaccines, the messenger RNA, as they're called, is not new. And we've had this for 30 years. We've used it for different things. It's the first time we've used it for vaccines, but it's not something that just came on the scene this year and we just created it this year. We've been using this for many, many years. So back to the slide, I want people to kind of get an idea of the normal vaccine process usually has 3,000 to 5,000 participants. So when we have 30,000 in Moderna and 43,000 in Pfizer, 73,000 participants, which was actually mandated by the government. They had to have at least 30,000 participants. That's a ton of data. We have much more data than we would normally have in a vaccine study. They also mandated that they had to go through at least 8 weeks of data before submitting to the FDA for authorization, because we all know from the prior vaccine studies, that most 95% of the adverse reactions will happen within the first 6 weeks after getting the vaccine. So they mandated that they have 8 weeks of data, so they know they would catch 90 to 95% of any adverse reactions, again, in 73,000 participants. I want people to know that both studies included a significant amount of African Americans. Like I mentioned before, usually only 5% of studies have, or 5% of the are African American in these studies. Moderna had 9.7% African Americans, and Pfizer had 10%. So almost double, pretty much double the normal baseline. And they also included people with diabetes, hypertension, lung conditions, people on medications, people older, say 80, 85, and younger down to 16 or 7 or 18, depending on the particular study. So again, we have a lot of information to know that they're safe and that they're effective. It was not too fast. We did it quicker so that because we had so many deaths going on. Next slide. So I want people to know what will happen. So I've been giving these shots to staff and patients over the last month or so. But from the studies, the 4 most common expected effects. You can expect these things to happen. You're going to potentially have headaches, body aches, joint pains, or fatigue, feeling really tired. Those are 4 things that you should expect. If they happen, that means my immune system is working, the vaccine is working. I'm expecting this. These usually only last 1 to 2 days. Maybe a little worse. The studies have shown after the second injection. So the first one, you might not have, as much of a reaction, but usually after the second injection, it happens a little worse. Now, when we say these are the most common, they only happen in about 10%. Those are the most common ones. So 90% of people won't have any real effects, but if you're going to have, if you're in that 10%, you'll have these particular side effects. And interestingly enough, as we get older, our immune system gets a little weaker, but luckily that means that we get less side effects. So both studies saw that as you get older, over 65 actually had less side effects than people 55 and younger. So potential benefit of our maturity. My experience I put in here. So I, again, joined up because I wanted to have representation of African Americans in these research studies. I called up in early August. They took my name, number, asked me a lot of questions. I actually went in late August. Again, more questions, drew my blood, swabbed my nose for coronavirus, and then gave me a shot. That was late August. I had a little arm soreness. It didn't get swollen, didn't get red, but it was sore, like I, got a shot. And we had to fill out forms, fill out an app, all our symptoms that we were having, had to take our temperature for 7 days. And then once a week, we'd get a phone call, did anything change? 28 days later, went and got my second shot and did again, nose swab, blood work, answering questions. After my second shot, I didn't actually have any side effects at all. And then answering more of the questions and the apps. And this was all with Moderna again. I will say that of all the shots that we've given at my office, and we've been given Pfizer, a lot of people have been having the side effects that are the expected effects that are listed here. Sometimes they had so much arm pain that they needed to take some Tylenol or Motrin, which is okay. Don't take it beforehand, but it's okay to take it afterwards. But these effects, that was my experience, and many of the folks did have more reactions after their second shot at my office than with the first shot. Next slide. And this is my last slide. I'll finish up here. If you're not getting vaccinated, it's a risk to yourself, obviously, and we know there are short-term and long-term effects from getting coronavirus. We definitely know, I just told you about the short-term risks from the vaccine. And again, those only last 1 to 2 days. Not too many, we don't know of any long-term effects just yet. And we're gonna keep watching those. It's a risk to your family. So, anytime we get something, and then the most common contact is our family. And we don't wanna bring things home to our family. More mutant strains, if you're not getting vaccinated, it puts pressure on the virus to change to be able to infect people more easily. And then obviously, if we're not getting vaccinated, this whole pandemic situation will last even longer, and we could be in this situation for years to come if we're not getting vaccinated. So I'll stop there, and hopefully we can have a lot of questions and give a lot of answers. Thank you.
All right, Dr. Jamal Gwathney, thank you very much for that. Before we get into the questions, we want to take a post discussion poll here and find out from you all who are listening. Now that you've heard from our experts, are you planning to get the COVID vaccine when it's available to you? We've got that poll up there. You can just click the button and we see the numbers rolling in. So we'll have to see and compare. I'll give you a few minutes here to click. All right, it definitely looks like most people are going to go ahead and get the vaccine when it's available to them. So far, 82% say yes, 4% still say no, and 14% say maybe. So it'll be interesting to see how that compares to how you all responded before our panelist gave the information. I want to jump into the questions now and get to those, because that is why we are here, to answer your questions. So I'll start with a couple here. This one is from Daisy Alonso. She says, once I get my turn to get the vaccine, will I have the choice to select from Pfizer, BioNTech, or Moderna? And any one of you can jump in and answer that.
It will basically be based on the vaccines that are on hand at the vaccination site, wherever they go. So you don't get to choose.
Mm.
Yeah, I advise, especially with the two vaccines that we have, there's really no discernible difference as far as efficacy. And my advice is get whichever one is available. This question has come up before, and because the Pfizer vaccine requires more storage restrictions as far as freezing, there were some that had some issues. And if that's your concern, I think that if you can access something else, fine. But I would get the first one that's available.
All right. And this question is from Daisy Alonso. Is there a probability that flu deaths were not reported because it might have been classified as COVID by mistake?
Well, there's always a possibility, but we have a very defined process for documenting influenza deaths as well as COVID deaths. And they're both laboratory confirmed. So it is certainly possible that people can have both, and in many cases, patients are tested for both. And if they are tested for both, then that documentation is provided. Right. And then I was just going to say, if they did test for both and they died, then you would have the deaths documented in the influenza watch as well as the COVID watch.
Okay. Thank you.
There's actually interesting paper talking about combined flu and COVID because across the country it has certainly occurred. And some people believe that you get the flu, it weakens your immune system, making you more vulnerable to COVID. And because there are folks that have both COVID and flu, but usually they'll put COVID first, but they believe the flu infection can weaken your immune system.
So Nora, what are you doing?
I'm putting a link to the flu.
Oh.
And let's just be clear. The public health interventions that we've had in place, staying at home or distancing or wearing your mask, have contributed to much fewer flu cases and then flu deaths. So it works not only for influenza, but they work for coronavirus as well.
All right, that was actually our next question. You answered that perfectly, Dr. Gwathney. Thank you very much. The next question, Daisy also asked, why ages 18 and below, why will they only be given the Pfizer vaccine? Is there any reason for that?
I can answer that. So the Pfizer vaccine was authorized, both of them are authorized versus approved by the FDA. And the Pfizer studies did their studies on 16 and up. The Moderna only did their trials on 18 and up. So by law, only the Pfizer is authorized for 16 to 18. So you can't give the Moderna to anyone under 18 right now.
All right. Another question. What happens if you get the first shot and then you don't have supply for your second shot?
Recently, CDC came out because of that possibility. Because initially they were saying you needed to get Pfizer 21 days, the second dose 21 days, and the Moderna 28 days. Now CDC has come out that you can go out as far as 3 weeks. Because there might be some situations. We had an example of an individual who got their first dose in another state, or they got it here, I take that back, got it here, but they were traveling for work for their second dose. So having that window of an additional 3 weeks would help and help them not feel bad about not missing that, whether it was 21 days or 28 days. So that's the new recommendation out from CDC.
Actually, a couple of quick things I'll add on to that. So there is no upper limit to how far out you can get it. The CDC actually bumped it out to 6 weeks. And so you have a lot more time. You have 6 weeks to get that. But then they say if you're outside that window and you still get it later, you don't have to repeat any doses. You can still get your vaccine if it was 8 weeks, 9 weeks, 10 weeks. Get your second dose as soon as possible, though.
Okay. Another question here. What information do you have for patients with blood thinner medications and who have had previous cardiac arrest and valve replacement?
So first of all, when you have significant complications, it's always recommended that you check with your primary care physician, whoever's caring for you for that situation, whether we're talking about pregnancy and blood thinners. However, there is no obvious contraindication to blood thinners, other than what most folks who are blood thinners are contraindicated against, that you tend to may have bleeding. The first response is please check with your provider, because you may be on other medications that have a concern.
All right. Can any of you talk about the preventative treatments that have been used by other doctors during the early stages of COVID where no patients died?
So let me speak to that. I've been on too many task force. The governor appointed me to a COVID task force. There's about 12 of us. Most of them are much more knowledgeable than I am about viruses and whatnot. I'm on the National Medical Association task force, and many of these questions come before them. First, I am not aware of any study that showed preventive treatment without vaccination, social distancing, and that type of thing. So the thing that prevents you from dying is the social distancing, wearing a mask, washing your hands, etc. If they're talking about, vitamins, vitamin D, alpha interferon, those questions that came up, there's no hard evidence to suggest that any of that will in themselves prevent you.
All right. This next question kind of speaks to the availability of vaccines. The question is, can you mix vaccines?
So, I mean, I can talk on that. So we shouldn't mix vaccines. If everything is the way it should be, you should get Pfizer first dose, Pfizer second dose, Moderna and Moderna. If there were, the CDC made some recommendations, if there were some really extreme circumstances, you got Pfizer the first dose, and then for some reason you could not get Pfizer anywhere else and Moderna was available, you could do that. But that's very, very rarely. You should not do that at all, if at all possible. But you should try and stick with one brand and go up for both doses. But CDC gave that caveat, just in case there were some really, really extreme circumstances.
Dr. Wooten, did you have anything to add to that?
No, thank you. That was great.
All right. Can any of you speak to how reliable the PCR testing for COVID is?
Well, this is Dr. Wooten. I can say that it is considered the gold standard. It is a diagnostic test. It is not the serology test, which is a blood test that is used to determine if there are antibodies in a person's system after they have been diagnosed and recovered from COVID-19. It is what we are using, and we consider it to be reliable, and that's what we use to document laboratory-confirmed cases of COVID-19.
Okay. And I want to circle back to that previous question on mixing vaccines. Dr. Gwathney, you say we shouldn't do it, but do you all foresee a situation where there's such a shortage that people would have to?
Probably if we were in that type of dire situation, the CDC probably would come out with recommendations. But I hesitate to even have the discussion because it gives people license to do that. At the vaccination sites, I am very confident that individuals will get the appropriate vaccinations, and there should not be any mixing. There's always an opportunity for accidents to occur, but with the fact that we have immunization registries, that's the whole purpose. When a person goes back for a second dose, their first dose can be looked up, and it can be determined which vaccine they had for the first dose so that the second dose can be the same. So there's always what ifs. But I think in those type of situations, CDC would come out with additional guidance and recommendations, much like they did with the situation of the close adherence of 21 and 28 days for the second dose. When it was not possible to really do that, they came out with additional recommendations.
All right, thank you. This is from Sarita Nolan. She is a student. She says, as a Black disabled student, it is terrifying to see people in their 20s to 50s dying with underlying medical conditions. What are your thoughts on the change in vaccine strategy to be more age-based after certain groups?
Well, I'll start with that question because I'm very passionate about that. It is already age-based. If you recall the two slides that I showed you, it is age-based. We started out with individuals that are at greatest risk, and that is individuals that are 75 years of age and older. Then we added on 65 to 74, and then for phase 1C, individuals 50 to 64 years of age, and then people that are 16 to 49 years of age that have underlying medical conditions. So the strategies are age-based, but also it is embedded with essential service workers. The goal is to get people vaccinated that have the greatest risk of exposure and hence contracting the illness and having associated complications.
Yeah. If I can add to that, I'm passionate about it as well. My concern is, as Dr. Wooten said, it's already partially age-based. However, if it purely went age-based, 75, 60, 50, 40, the concern is I think we would lose our equity lens. So there are frontline healthcare workers who may be in their 20s or 50s that are at greater risk than somebody who's 50. And many of those are people of color. So I think we always have to keep in mind our equity.
All right, this other question here, are there any plans for a vaccine for those under the age of 18, school-age children? There's talk of returning students to school, but how is that possible with no vaccine for them?
I can certainly speak to that. I know Pfizer and Moderna are actively recruiting for pediatric studies as well as for pregnant women. So we're going to be getting data very soon on the 12 to 18 age range. I think it's so safe. Not only did I actually participate in the study, but I'm trying to sign up my child for the study, who is 13. So I do think it's safe, and I think it works. And we're going to be getting that data pretty soon with the hope that by next fall, we would potentially have children vaccinated to be able to start school in the fall. That would be great.
All right. Let's talk about allergies in this shot. If you're allergic to penicillin, shellfish, is it safe to get the vaccine?
Yes.
Short answer.
Yeah.
So
Go on, Dr. Hood, I'll follow you.
Okay, well, I'd really like to ask, usually if you have a significant allergy, it's always best to check with your provider, because what the layperson may call an allergy may not be actual allergy or anaphylactic shock. The worst allergy you're concerned with is anaphylaxis, and all allergic reactions are not anaphylactic. So it's very difficult to answer somebody's question when they say, I can't tell you how many folks come in telling me they're allergic to penicillin and tell me that they take ampicillin and all the other cillins, suggesting that they don't have a real allergy. But whether you are or are not, you can still get the vaccine. It's just at what level of risk you have. If you have a significant allergy, they usually watch you a little bit longer, 15 minutes, usually about 30 or 40.
Yeah, I would just add in that in December on the CDC calls talking about allergies, if individuals have allergies to food, they can get the vaccine. So for people that have no allergies at all, the waiting time is 15 minutes. If individuals have any type of allergies, the recommendation is 30 minutes. And if people have allergies to or reactions, not allergies, but reactions to injectable products, at the time CDC was recommending not to hold off on getting the vaccine. So it just depends on, as Dr. Hood stated, an individual, the layperson's definition of allergy is not the same thing as a doctor's definition of allergy. So first checking in with your doctor and getting the recommendations from there.
Yeah, so even that category, Dr. Wooten, there have been a group of allergists that even in the severe situation, that person probably would benefit from an allergy consult. So the provider should refer them to allergy consult because they believe there are ways they could still immunize them even if they'd have a significant allergy.
Correct.
All right. Another question here. Could people who live with a senior be prioritized to join those older adults at the top of 1C with the county's discretion?
That falls under the category of informal caretaker. And the individual, we've actually had a lot of discussion about this for our vaccination sites. And as we've stated, and I state often, is that we're not trying to be the vaccine police or documentation police, but we've offered and will offer on our website examples of documentations that people can bring on, particularly in that situation. They could get something from their doctor, a letter from their doctor saying that they are the caregiver, whether it's a child or an adult. So planning now for that, because that vaccination priority is already there. It's in 1A. So if people have had a problem or can't get vaccinated, that's what we would recommend, that they get a letter from their doctor, particularly for pediatric patients. And there's a particular the state's making this recommendation too, that you could get particularly if a child is registered to be getting services for a physical or a neurological disability, they can get a letter to support that for the parent or the caregiver to get vaccinated.
And someone has the same question for those who live with a high-risk healthcare worker.
Well, healthcare workers should be protected with the personal protective equipment. Hence, that is not classified as exposure. What we are trying to do is vaccinate those people that are high risk. I'm sure some people would like to make that argument, but in the current phases and tiers that are recommended, and I don't know, Dr. Hood, if you think differently?
Well, I think you're right, because the data actually shows that many of the healthcare workers have less infectious rates than those who are not healthcare workers because they are wearing PPE. So I think there are, if you're doing what they're supposed to be doing. But I do understand the concern and the anxiety of them trying to separate and isolate when they go home. And the goal is we need to, hopefully there'll be more vaccine, and most of us will be getting vaccinated in the next several months, no matter who you are.
All right. Another question here about the effectiveness of the vaccine. Are there any studies yet to show how effective it is against the new strains that are out?
I can take that one. So yes, both in the UK and here in the United States. So 3 different strains that are out there right now. The current Moderna and Pfizer vaccines are effective against the UK strain. And the difference between, say, the UK strain and the Brazil and South African strains are that the mutations, there are 3 mutations on that spike protein, that S protein, but only 1 mutation on the UK version. So those 3 mutations make the current vaccines a little weaker and less effective for these Brazilian and South African. They still work, just not as effective. And I don't know if people remember, but when the FDA put out their call for vaccines, they said they wanted their vaccines to work at least 50%. So 95 and 90% is really high. So if even with these new strains, the vaccines come down to 75%, that's still really good. And so we just want to keep that in mind, that the UK strain, it does work. The other ones, it will probably work less.
Okay. Another question is, what's known about how long the vaccine is effective after you get it?
Well, I'd say that's the $1 million question.
Yeah, exactly.
I will say that. So, myself, I'm 5 months into the study. There are folks that are just coming up on 6 months because the Pfizer Moderna study started July 27th. So they'll be getting data for a 6-month mark right now. And so we're all waiting to get that information right now. We do know definitely 3 months. I'm pretty sure it's going to be definitely at least 6 months. And it remains to be seen when we get more data.
Okay. Do you guys foresee a situation where, COVID is just here to stay and people, in order to manage it, will have to get booster shots? I mean, how do you see this playing out, and how do you think people will have to manage their health?
Well, I personally feel it may look like, in terms of what we do every year with seasonal flu, is to administer a vaccine based on what's been circulating. So certainly we could evolve into that practice, but right now we just don't know. So as more research is made available, then that will dictate or drive the policy decisions that are made regarding repeated vaccination policies.
Okay. Another question here is, will the county create any type of online COVID-19 memorial so that people could share photos of loved ones or testimonials to honor those lost, but also encourage people to respect the risk and get vaccinated to protect others? Have you guys given that any thought or any?
I think that's a great idea, but we have not, when you talk specifically about the county, we have not had any discussions about that. But it's a recommendation that anyone can submit to their Board of Supervisor for consideration.
Right.
I think it's a great idea.
Yeah. Here's another question. Every site on the COVID vaccine site says no appointments available. How does one make an appointment to get a vaccine when this is happening? My doctor's office is not open, so that is not an alternative.
Well, the locations where vaccinations are predominantly being administered are the community pods and the super stations, and also some local pharmacies, those not particularly those that are associated or affiliated with the CDC partnership to vaccinate in skilled nursing facilities or long-term care facilities, but our routine commercial pharmacies, some in the community are vaccinating. So those are locations where people can get vaccinated. And it's all contingent on the availability of vaccines. Keep in mind, if we had ample supplies, we wouldn't have to be bothered with the prioritizations. That's the whole purpose of the prioritization, is because we knew that there would not be ample vaccines out of the gate. So people just should be patient, continue to press refresh so that they can try to find if they are in the categories that are being required for vaccinations. Patience is a virtue in this particular case, for sure.
So let me add to that. I kind of serve on the county tri-chair vaccination clinical committee, and I really believe overall, as frustrating it is for those who are trying to get vaccinated and cannot, I think the county is doing a stellar job. I remember about 2 weeks ago, maybe there was no super vaccination sites. UCSD started. Now, if you go up there, there's one in South Bay. They're opening up one in National City. I just checked. There's one day out of the week at Tubman Chavez. So every day when you go on, there's more and more vaccination sites opened up to make the access better. Sometimes, though, the issue, as Dr. Wooten said, is there's not enough vaccine right now. You just heard they were talking about everybody thought there was a set-aside vaccine that could come. There isn't. So I think as the pharmaceutical industry ramps up and starts pushing out more vaccine, it will become easier.
Someone asks, my immune system is not compromised. Would it be possible to obtain a waiver for this vaccine and just wear a mask?
Well,
go on.
Well, I would say a waiver. So that would imply that the vaccine was mandatory,
right?
And that you would have to get a waiver to not get it, but it's not mandatory. So you don't know, no one has to get it. And there's right now no requirements to get a vaccination in order to fly or anything. That may come in the future. I don't know, but none of that is in existence right now. So no need for any waivers at this point. We would just encourage everyone to get the vaccine as soon as they can, if they would like to.
Someone says,
thank you.
Go ahead, Dr. Wooten.
I was just going to say that there's no health officer order that mandates anyone to be vaccinated. So a waiver, again, is not necessary.
All right. And here's another a question about accessibility. Not sure if any of you would know, but this person says, I tried to sign up through My Turn online and needed a UCSD card. However, I have TRICARE. Does that disqualify me? I do not have a UCSD card.
UCSD is signing up people through MyChart, but we are going to be transitioning. The plan is to try to transition over to MyTurn so that all of the sites, the vaccination sites, are in the same system. But MyChart is, if you are a UCSD patient, it is the personal EHR. I'm a UCSD disclosure patient. So that's the platform by which they communicate with you about your appointments, your medications, your vaccinations, and everything like that. So our plan is to try to transition all of the vaccination sites to MyTurn. But again, it may be difficult to get a vaccine or an appointment for vaccination. So again, continue to try to refresh and continue to schedule the appointment. Again, we're asking people for patience. Now, depending on where you received your, or how and where you received your first dose, the process to get the second dose vaccination might be different. So if people got their first dose early on, they went through what's called ProMed, they will get an email notice to schedule their second dose. If you go through now the current super stations, there is the process of getting your second dose scheduled at the time you go through, so you know when you leave when your second dose is. So there are different processes currently in place, but we're trying to coordinate them all to one system.
So this is just point of information. The UCSD county site at Petco Park, if you got your shot there, in order to make an appointment for your second shot, you use UCSD MyChart, whether you are a patient at UCSD or not. You would just sign into MyChart as a guest. So it was used to kind of help people follow up on their second shot. And this is whether you were a UCSD patient or not. But as Dr. Wooten said, hopefully we're going to go to one system where you don't have to worry about the system.
And I just want to, that last question, the person mentioned they had TRICARE. So if you have TRICARE, like I do, definitely TRICARE is providing either through the VA system or through the MTFs, our medical treatment facilities, vaccinations. And please go online to TRICARE and see if you can get vaccines through that resource as well.
And before we go, I do want to circle back because there are a few people asking the same question. They say their doctor's office isn't offering the vaccine. How can they get it?
Again, anyone, if it is their turn through the phases and tiers, they can go to and actually we'll put it in the chat, the website where you can sign up for tests, for vaccinations. And we have multiple, I think we have up to 6, and the plan is to go up to 12 community pods, points of dispensing, and we currently have another one being stood up this week. So by Monday we will have 4 super stations, and there is planned for a 5th coastal super station later in February.
I'd like to say, being in private practice for as long as I have, I transitioned my practice into a federally qualified health center. We've begun to schedule 75 and older appointments for the next 2 or 3 weeks. And I believe as we move forward, you'll see more and more clinics offering vaccine. But in the meantime, Dr. Wooten is right. You can go to the county website, and if you fit to certain categories, if you're persistent, you'll be able to find a place to get vaccinated. Patience.
And persistence.
Yes.
Yes. Okay. Before we leave, I do want to circle back to the polling that we took at the beginning of this. Are you planning to get the COVID vaccine when it's available to you? 73% said yes, 7% said no, and 20% said maybe. That was then. And then let's take a look at what we've got now. for polling number 2. We've got 82% saying yes now, 4% saying no, and 14% saying maybe. So we certainly hope that the discussion has helped you to reach a conclusion in this. And on behalf of the Multicultural Health Foundation, I want to thank you all for logging on. I also want to thank our panelists, Dr. Jamal Gwathney, Dr. Wilma Wooten, and Dr. Rodney Hood. Thank you very much for all of the information tonight. I'm Jade Hindman with KPBS Midday Edition. Have a good night and stay safe, everyone.